Today, we're talking about narrative therapy, a healing modality for trauma. Welcome, Dr. Nizami.
I'm excited to be here. Narrative therapy is my heart and really the core of a lot of what I do. So I'm excited to share it and hopefully give people just a sneak peek into what it could look like if you have a narrative therapist or from a narrative lens, how we approach cases here at the collective.
So what elements of narrative therapy make it a healing modality for trauma?
Inherently, narrative therapy, you mentioned it in my bio, is a postmodern theory. And part of postmodernism is really taking the approach that we don't have to be bound by the things that happen in our lives. So there's this underlying foundation for humans to heal and for change to be possible. The foundation that I really emphasize with clients pretty early on is that we have relationships with our problems and that we're not the problem. We can often sort of feel like, I am the totality of my life problems. I am depressed. I am anxious. I am the problem child in my family, right? And I think it's helpful from this lens to sort of take a different stance and instead invite the client to understand that they actually have a relationship with depression and sadness, or they have a relationship with anxiety, and that there's this other part of them that's actually not wholly and fully and totally depressed, right? And so if you start there with clients, it kind of shifts what people feel like they know about themselves and even creates maybe some curiosity of like, what is the other part of me that could also be existing at the same time as depression? And so if we can help people learn this, help them believe it, and actually start to integrate their life with these sort of belief systems and distancing themselves from the problem, we can often help create a detachment from the pain and the suffering that may have been caused by trauma or by grief or, by something pretty horrific happening in their life that has caused them to believe those things about themselves. And then instead we can shift towards resilience, right? Resilience that you can heal, resilience that you have kept going, resilience that you've been able to get here today. And even if all that other stuff is true and it has an impact, it doesn't have to have the full impact on who you are sitting with me. So that I feel like is usually where I start, is introducing the elements of these foundations to the client and helping create what I think is a really unique approach to doing identity work and trauma work.
I have to assume with the curiosity comes some relief. I mean, just listening to you explain it, I can identify and I can even feel some relief. So I have to assume that's a space that the clients are willing to open up and sort of exhale and are willing to explore.
For me, it was similar to you, a relief of my own stuff when I was going through my master's program and I was learning about all these theories. This theory really stood out to me because it helped me make perfect sense of why I was the way I was and like what happened to me to get here. And you could look at your identity in this way that wasn't confined and instead, transforming and becoming and, wasn't a stagnant thing that you couldn't move, right? It was, I could do anything with this person that I am.
Right. I love it. Excellent. So you touched on it a little bit, but talk to us about how the collective integrates narrative therapy.
We do a few different things because of my influence with narrative therapy and my love for it. I started a narrative therapy group, which is really a writing group. And narrative therapy in its essence is about storytelling and language. And how we storytell and language our life story is important. And so in this group, we really focus on individual time to really focus in and tell our story. Because I'm the assistant clinical director, I get to sort of tap into what I know clients are working on, what they're maybe focusing on specifically around stuck points or specifically around the impact of trauma or what it's done to my identity or powerlessness. So I can bring these elements in and create really unique prompts for them to write and to storytell. And eventually, after the time ends, we get to talk about it as a group. And so there's this element of retelling the story, which in narrative therapy is also very important, right? If we have a problem-saturated narrative from trauma that is highly focused in the things that have happened to me have gained control over me or impacted my ability to have power or protect myself. And that's how we're telling our story. Well, we're more inclined in vivo to feel powerless. We're more inclined to not feel like we have a voice. And so instead, I get to help clients rewrite and reconstruct that authorship of the story. And so if there's a moment that they felt powerless, well, what would you have liked to have said in that moment, right? Let's write that into the story, right? Let's actually build it into your historical recollection of the event. And that's part of the narrative trauma work, is you can actually have power over how the story is then retold, which is really powerful, I think, for a lot of people, especially when we're thinking about trauma, which is things that have often been done to us. From this lens, we can decide how we want to tell the story. And now we have full control over what people hear about what happened and what people know about who I am because of this thing.
Incredible. And I think such a testament to our intimate and small census, that you're intimately aware of everyone's work, and to be able to bake in different modalities around their unique needs and interests is incredible.
By the way, so we do the group weekly. And then once every 2 to 3 months, we do something called the Expressive Art Showcase. And that's an opportunity for them to share beyond the group. So the intimate space is important, but even sharing with staff members and other peers here, we give them the opportunity to share and experience an in vivo storytelling of their preferred narrative, which can be really impactful and healing for that client, and also other people who are now listening to what they know has been a problem-saturated issue for them, and now to see it transformed in this really beautiful.
Amazing. How does the practice of reauthoring personal narratives and narrative therapy influence a client's perception of their trauma and overall mental well-being, which you've touched on, but if you wanted to sort of bring it all together?
So I started with talking about how most of the time we have these ideas that I have become the thing that has happened. And it's preventing me from accessing my preferred life. And so when we can challenge that totalized idea in a way that helps people understand that they are more powerful than they think, and that they have the power to define themselves and to live their life in a congruent way that feels right for them, we can start to step away from all the other symptoms that come with feeling totalized and powerless. And so it reclaims that author position where you again get to talk about how your past has existed for you in a way that isn't isn't out of your control. And so we work to change the language, we work to change how we understand the trauma, we sort of look at our future in a different way and can actually have more hope around my past not, directing my future, and rather just influencing it. And so the focus around, the power of the words and how we talk about and share our stories can be really helpful with stepping away from that totalized perspective of who I am. I think in our world, if I'm being honest, it's really easy to get consumed into a totalized identity. And so this could work with trauma, but this could also work with culture or race or queerness, right? It really has the overgeneralization and broadness to work with any aspect of identity.
Right. So exciting, so hopeful. Thank you so much for sharing today. This was a pleasure to be with you.
Thanks,
Dr.
you,
Nizami.
Sarah.